Hi, my name is Sierra Molina. I'm a student at the University of Florida in the McNair Scholars Program, and today's presentation will be on police mental health teams, a systematic review of their effectiveness. So for my research this summer, there was two primary aims. The first one was to conduct a systematic review, and this would be looking at all the current literature on co-responder teams, and then we would then assess if those teams were effective in reducing the amount of people with serious mental illness in our jail system. The second aim was to use those results from the review to inform implementation, data collection, and analysis for our local co-responder teams at Alachua County Police Department and Gainesville Police Department. To begin this discussion, we'll talk about the timeline regarding mental illness in our criminal justice system. The first topic will be deinstitutionalization, which happened in the 1960s. So this movement cut government funding for psychiatric wards and placed a greater emphasis on community care. But unfortunately, this model didn't work out because a lot of communities were unable to support these mentally ill patients. And unfortunately, a lot of them ended up as homeless, or they entered our criminal justice system as being arrested. And you'll see that in the statistic below, that 50% of those arrested in 1982 were homeless prior to that arrest. So what this resulted in was a lot of calls for crisis. So police officers became a new frontline worker because they were dealing one-on-one with these psychiatric citizens. So that moves on to mental illness in our jail and kind of where we are today. So nearly 15% of men and 30% of women booked in our jails have a serious mental health condition. Also, in relation to our local stats, Alachua County reports that 22 to 28% of those jail inmates have symptoms of serious mental illness as well. So we see that because of this movement, right now, there's a lot of individuals suffering from these conditions in our prison and jail system. So as more individuals with serious mental illness came through our jail system, a lot of officials wanted to come up with approaches to handle the increase in crisis calls. So the first thing to understand is the sequential intercept model. So this model basically depicts how an individual goes through our criminal justice system, starting with the first call to police all the way to a jail or prison sentence. And in analyzing this model, community-based organizations can actually develop strategies that would increase the diversion of individuals with mental illness. So they can implement treatment options at the beginning stages so these individuals don't repeatedly make it through our criminal justice system or end up with a long-term prison sentence. One of the more specific settings was crisis intervention training. So this was 40 hours of training that law enforcement was given, all the way from de-escalation training to understanding mental health diagnosis. So then when they were called to these crisis calls, they were able to help individuals and not just escalate the situation by using a loud voice or force. So one of the more recent developments that has kind of branched off of crisis intervention training are crisis intervention teams. So these teams actually consist of mental health professionals as well as law enforcement. So when they're called to these calls of crisis, they're able to handle it from different perspectives and not just one that's more penal in nature. So right here, you'll see a visual of the sequential intercept model, and we're going to focus on stages 0 to 2. So really applying community-based treatment to help divert that individual from a more serious prison or jail sentence. So for today's presentation, we'll focus on one community-based initiative, and this is the crisis intervention teams, and they fall between Intercept 0 and 2. So for crisis intervention teams, there's actually around 19 different models. So the one we're going to focus on today is the co-responder model. And this model is a unique partnership between an officer and a mental health professional. So the officer is trained in crisis intervention training and then is paired with a mental health professional to ride along to then attend to calls of crisis. So these calls of crisis could be anything from someone is experiencing hallucinations all the way to suicidal ideations. And the officer as well as the mental health professional work together to help de-escalate conflicts in the community and eventually divert these individuals who are experiencing these psychiatric episodes to treatment options instead of placing them in jail. And what's awesome about this is there's actually a local impact that we'll talk about later in the presentation, and that's Gainesville Police Department. So GPD implemented this program back in 2018, and the data is currently being reviewed in order to see if this program has the perceived benefits that they assume. And some of these perceived benefits include a reduced number of crisis incidents, a reduced number of re-entry for lower-level offenders, as well as an increase in community treatment options. So by diverting individuals from jail, they're able to access community treatment options more readily. There's also a decrease in stigma because the community understands how to handle mental health calls. And one of the most reported things is officer level outcomes. So how does the officer perceive their ability to handle individuals that are experiencing crisis? And are there less incidences involving officers? Our current study this summer focused on one question, and that was, are co-responder teams effective in reducing the number of individuals with serious mental illness in our jail? These are a few key terminologies. The first one is a revolving door phenomenon. This is the idea that individuals continue in and out of facilities, whether that be a jail facility, a mental health treatment facility, because they are released prior to them getting the adequate treatment necessary. The second thing is co-responder teams. So specifically in Gainesville, our co-responder team is one police officer and one mental health professional that go out to attend these crisis calls and help de-escalate conflicts. So instead of just an officer, they're joined by a mental health professional as well. The second thing is calls for psychiatric emergencies. So this can be anything from a welfare check on an individual to experiencing hallucinations, and an officer needs to be called to handle that. The third thing is diversion types. Like we said before, we really want to reduce the revolving door phenomenon and divert individuals into treatment instead of correctional facilities. And these diversions could be a support group, Alcoholics Anonymous, anything along those lines. The fourth thing is effectiveness. So is this program effective in helping deliver the adequate treatment to individuals? For the methods used in my literature review, I reviewed a systematic review by Puntis 2018, and the full text review included over 6,017 articles. After further review and full text review, 26 articles on co-responder teams and crisis intervention training were able to be analyzed. I specifically chose to analyze only 12 of those 26 articles because those 12 articles focused on the direct relationship of a co-responder team, which included one officer and one mental health professional. I also researched 4 other articles that included findings after 2018 that had more relevant research on the effectiveness of these teams. I also used 6 keywords, including police, mental health triage, co-responder teams, diversion, effectiveness, and calls for psychiatric emergencies, also known as crisis calls, to limit my research, but also to get a better understanding of how people reported on such incidents. For my results, I assessed the 12 articles that talked about co-responder models, as well as the general characteristics of service users published by Puntis. So what they found was the individuals that were experiencing these episodes of crisis and coming in contact with co-responder teams were usually around 39 years of age. They were usually male, and they identified as being African American. They also held a repeat offender status, so they were known to mental health professionals in the community already, and some of them had already had a jail or prison sentence. They also talked about police perceptions. A lot of officers perceived that after they received the crisis intervention training and they were placed in a co-responder team, they felt like they were more equipped to handle calls of crisis, as well as work with community partners. They understood the role of mental health professionals a little more. However, based off the preliminary articles, we were unable to conclude if these teams were actually effective in reducing the amount of individuals with serious mental illness in jail. And this is because there was a lack of pre-post surveys. A lot of studies did not conduct these follow-up surveys that could see if they were effective. Also, treatment follow-ups. After an individual was diverted from jail, they did not follow up with them seeing if they got the adequate treatment and if they stayed out of our system, hence the revolving door phenomenon. Lastly, there was differences in descriptions of service characteristics, which made identifying a model very hard across all the studies. So after reviewing the preliminary findings, I really wanted to assess why this topic was important and some future aims for the research. And I found that at a local level. So Gainesville Police Department implemented a co-responder team back in 2018. And for that calendar year, they recorded 431 incidents or calls for crisis that the co-responder team responded to. And what that kind of attests to is the greater need for treatment options for these individuals, and also a more accurate follow-up to see if, when given these treatment options, when they are diverted from jail, are they successful in staying out of our criminal justice system, or do they continue to recidivate? You'll also look at the statistics of individuals that are inmates in jail and have serious mental illness, which just kind of emphasizes the problem that we have now. So 22% to 28% is the findings for Alachua County, which aligns greatly with the national average, which is around 24 to 26%. So moving forward, I want to complete a more intense systematic review, looking at service users and the effectiveness of that service. So when individuals came in contact with co-responder teams, were they effectively diverted from jail, and after follow-up, did they receive adequate treatment? The third thing is to compare GPD data with national averages to see if they align with previous statistics. And the fourth thing is to analyze jail entry data in comparison to GPD data. This would allow us to create a pre and post assessment to really test analytically if effectiveness occurs and if individuals are diverted from jail. As I wrap up this presentation, I would like to give a couple acknowledgements. First, thank you to Dr. Gibson for his mentorship and support throughout this summer. I have thoroughly enjoyed working together and learning about the topic and its impact. A special thank you to the McNair staff and advisors for their continuous support and guidance. This summer has been an incredible learning experience, and I'm excited to continue forward together.